स्टार्ट करना। ठीक, एक मिनट, जब ये चेंज करना होगा तो उसको मैंने क्या करना, सिर्फ इसको बस में। Assalamu alaikum. I am Dr. Iqbal Rao, Associate Professor, ENT Department, People's Medical College, Nawabshah. So you know that we have complete ear, nose, larynx, and now some remaining topic of throat, in which the important one is tonsillitis, in which we have two varieties, that is the acute tonsillitis and the chronic tonsillitis. And then operative complications, indications, post-operative complications. These are very, very important for examination point of view, theory point of view, MCQ point of view. And in which the other important topic is a quinsy, pharyngeal diphtheria, that's why some mucus fibrosis and some oral disease. So we have inshallah completed these things one by one, and that you keep in record, because these things are very important for your examination point of view and your YOC point of view. So today we start a throat. You know that throat is divided into three parts because it is a big topics: oral cavity proper, oropharynx, and the hypopharynx. The other name is a laryngopharynx. And if we are going to a pharynx side, and that have divided into three parts, that is the nasopharynx, oropharynx, and the hypopharynx. So we are here in this topic is a oropharynx, because in oropharynx there is a very, very important structure, that is tonsils. You know, these tonsils are present in oropharynx. Oropharynx. Sometime examiner asks you where is a tonsil, that you should be confused, that you say that it is in throat. This is not a correct answer for you. So you give the answer that these tonsils is a palatine tonsil. They are present in oropharynx. They are present in oropharynx. These are two in number. These are two in number. Sometime examiner asks you how many numbers of tonsil is present, palatine tonsils. You say, sir, it is two in number. So it is a lateral side of the oropharynx. You know, they have name palatine tonsil. They are present in oropharynx. Which one? Oropharynx, not oral cavity or the hypopharynx. It is present in oropharynx. So the thing is arise that what is tonsil? Simply, you brief, sir, these are lymphoid tissue. These are lymphoid tissue. So there is a many lymphoid tissue, that is adenoids. These are lymphoid tissue, tubotonsil, lingual tonsils. These are present. These all the things which are present: palatine tonsil, lingual tonsil, tubotonsil, lingual tonsil, adenoids. These form a ring. That ring name is a Waldeye's ring. That have important is that it give a protective function to our throat. They fight against the things which are enter inside the throat. So this is our defense mechanism, you know. So tonsils are basically present by birth till death. They are with us. These are our good friends. So these are present by birth till death. If you are removed from the disease purpose that you should be removed. Otherwise, it is present all our time with us. So tonsil is a basically almond shape, having a two pole, upper pole and the lower pole, and they have a two border, anterior border and the posterior border, and having a two surface, that is a medial surface and the lateral surface. You know that in a tonsil there is a multiple pores, that is pores inside the tonsil, and there is a big hole in the upper pole side that is known as a crypta magna, or you say intertonsillar cleft. This is the big hole at the upper pole side. Okay, these are present in an oropharynx. Now I put a picture in front of you. It's a very good picture, and clear all these things which are present in your mind. You know, arrow shows both side of the tonsils, These area is palatine tonsil area, and the position is a palatine. These tonsil name as a palatine. So this is a hanging structure. You saw that this one is the uvula. U1 is the uvula. So here is a, you say, situation, size, shape, medial surface, lateral surface, importance of bed of tonsil, history of tonsil, arterial blood supply, venous drainage, lymphatic drainage, nerve supply, and the function of the tonsil. Just for your knowledge, you must know these things, important things. Where is a tonsil? How much surface? How much border? Pores is at 10 to 12. There is a multiple pores. Then there is a big crypta magna. These have an arterial supply of the tonsil is a very important. Sometime examiner asks, you know that there is a facial artery, there is a ascending pharyngeal artery, greater palatine artery. You know that there is a dorsal lingual artery. These are supply. And the important lymphatic drainage is jugulo-digastric lymph node. You must know that. The jugulo-digastric lymph node. Okay. So these are the things which are present in. You know, this picture is also clear you. That is a pharyngeal tonsil, you know. There is a arrow show. Then there is a palatine tonsil. And then there is a lingual tonsil. This is a cut slide. And you show that where is a lingual tonsil, where is a palatine tonsil, where is a pharyngeal tonsil. There is another view in which you see there is a adenoids, tubal tonsil, lateral pharyngeal band, nodules on the posterior pharyngeal wall, palatine tonsil, lingual tonsil. This give a slide, and this give an idea, and this show a Waldeyer's ring. Just now I brief you Waldeyer's rings. So these things form the Waldeyer's rings. This is also a cut slice, and some name there is a bookish picture. So you see it there. You know that there is a blood supply. Blood supply is a tonsil. You know, 4 major vessel is there, which is just I brief you here. You know, there is a lymph nodes. There is a picture is in front of you, but in tonsil point, the very important thing is a jugulo-digastric lymph node. This is, you say here also, as supply there's nerves, arteries, vessels is there. And the important thing which should be a bleed there is a paratonsillar vein. Paratonsillar vein is just from starting to end, they are with tonsil. Now we come to our proper topic. This is your information about the anatomy of acute tonsillitis. Now we are going a disease. The name of a disease is a acute tonsillitis. Simply you know the definition, that is an inflammation of the tonsil or the lymphoid hair tissue. Palatine tonsil is called acute tonsillitis. And in a picture you say that there is a well red area hole there, a tonsillar side, and along with uvula and all this. This is a picture of acute tonsillitis. So there is a etiology that is a very important one here. That is, you know that there is a predisposing factor, that is a journal, that have a local, that is a overcrowding, unhygienic condition, inadequate ventilation, low resistance of the body, age, seasonally, autumn, spring. These are the predisposing factor. And locally, taking of unhygienic stuff, sore things, cold things, local sepsis in oral cavity and nose, this is a teeth, rhinitis, and the sinusitis. Mouth breathing due to a nasal obstruction, adenoids. In cases where the children mostly affected, because it is especially a school-going children disease. So that having a problem if adenoid, they taking all the time, respiration is throat. So that having also affected from the disease of acute tonsillitis. And then there is a local is a remnant of tonsils. B, that is exciting. You know that there is a things which is a very important here, that is a bacteria and virus. You know, sir, initially there is a take of a viruses, that is a adenovirus, influenza virus, parainfluenza virus, rhinovirus. The most common is a adenovirus. Early, this is a attack of a virus, then it is converted, change into a bacteria. And you know, bacteria is a main bacteria is a Streptococcus beta hemolyticus. That have an importance here, Streptococcus beta hemolyticus. Then their second is a Staphylococcus, and then there is a Pneumococcus. So we have a bacteria, we have a virus here, there an etiological factor, then there is a journal factor, local factor, relating factor, neighbor factor. You know that these are going to cause the acute tonsillitis. Now you see the pathological stage and in front of you, you have a good picture is there. You know that the things is clear in picture that have a pathological stage. The first stage is acute catarrhal tonsillitis. And second stage is a acute follicular tonsillitis. Number third is a acute membranous tonsillitis. Then parenchymatous tonsillitis, and there is a acute ulcerative tonsillitis. Okay. So the first one is acute catarrhal. You know, it is a superficial. When there is a strut, we say acute catarrhal tonsillitis. When there is a follicle beads inside the tonsil, when we put before this picture, there is a follicle on the tonsil that we call is a acute follicular tonsillitis. When there is a dirty membrane is formed over the tonsil, which the substance released from the crypts and they come over the tonsil, we call is a membranous tonsillitis. And when there is a huge tonsil, they are so hypertrophy and they have meet to each other. The other name is a kissing tonsil, or we call it as a parenchymatous tonsillitis. And when there is an ulcer and there is erosion, then we call is a acute ulcerative tonsillitis. Now the symptoms, what happened when these things occur? What is the problem with us? Yeah, what problem our body have? So generally we have seen that is a fever, and this is a very severe. They may be 100 to 105 degree Fahrenheit. There is a lassitude, headache, body ache. These are the things which patient have feeling there. and then locally discomfort in throat. I am feeling in throat discomfort. Dysphagia, foul smelling breath, pain in leg, lump in a neck. Something is present in my throat. Something is, I'm feeling that there is a something in my throat. That is a lump in the neck. Lump in the neck. The episode is usually last for 3 to 5 days. This episode usually lasts for 3 to 5 days. Generally, if we have a go to sign side, okay, what sign we have observed, patient look toxic. Patient look toxic. Face is flushed. Face is flushed, flushed. Temperature is raised. Pulse rate is increased. Local foul smelling from the breath. Lips are dry. Tongue is coated. Tonsil finding according to clinical stage. Clinical stage, what mean? When there is a pathological, we see that area. That is pillars, soft palate, and uvula congested. Regional lymph node are enlarged and tender. Regional node is a jugulodigastric lymph node. That is an important node we see. That is a very important sign. Very important sign for in operative cases of a chronic tonsillitis. Now we are going to investigations. The important investigation. Number one is the blood picture. Here we see there is a leukocytosis. Increase that cell, leukocytosis. And the important one is here, throat swab. Which one? Throat swab. That is a causative organism show. The causative organism, which one? Bacteria. Bacteria. When you open backslide investigations, so you have a name there in causes, there is a bacteria. So we going to the throat swab. This is a very, very important investigation. That patient come much, if there is a acute tonsillitis, we take the throat swab and give a culture sensitivity. When report is come that is a bacteria, that is your culture sensitivity. So it is a very easy for the treatment that we put a treatment over that sensitive organism, which medicine is a sensible that organism. Now third examination is a urine trace albumin, because it have a complication. When we go to complication that have clear the investigation of urine. Investigation of urine. Now the treatment. Treatment is a very important because you are in a 4th year, so you must know how we treat these acute tonsillitis, chronic tonsillitis. According to criteria, how we diagnose acute tonsillitis, how we diagnose a chronic tonsillitis. So it's a very easy, very easy, very easy. So now we are going to a treatment, and this treatment is a acute tonsillitis. Which treatment? Acute tonsillitis. What happened? Immediately that you give a bed rest. Then you put patient over the analgesics and antipyretic. Analgesic and antipyretic. Then third choice is you have an antibiotics. Before report is come, you must put our patient into a broad spectrum antibiotic. Okay. Now the second thing is a local things, in which we are going to a warm saline gargle. Warm saline gargle. Mild antiseptic throat paint, 10 to 20% throat paint, Mendel's throat paint, 2% tannic acid in glycerin throat paint. Antibiotic throat lozenges is there, strepsils is there. Okay, so you can use this medicine over the patient. Okay, and stop the sore things, salt things, smoking, citrus, all the cold things you should be stop the patient. Now the Other option which are present here is this is a surgical. That is a surgical. When this patient is going to a surgical site, it's must then there is a 3 to 4 attack every 3 to 4 months in a year. That it means then our patient is going towards the surgical side, our patient. So must there is a 3 to 4 attacks. Why our patient is going to surgical sites? Because there is an improper treatment of the patient, high virulence of the organism, and the low resistance of the body mucosa, low resistance. These three things, when present, then acute thing is converted into chronicity. Now, DD, which confuses with the other things. So it's very important for us that we have a must in our mind. There is a DD, that is a acute pharyngitis, pharyngeal diphtheria, Vincent angina, thrush or fungal infection, leukemia, acute infectious mononucleosis, agranulocytosis, scarlet fever, and quinsy. This is DD. Sometime examiner may be asked, so how you confirm that this is a acute tonsillitis? What are other structure maybe confuse you? So these are called DD, differential diagnosis. This is in front of you in a slide, so you should be noted. You know, these are the slides here. You saw whole area is a congestion, and that side of the tonsil have a yellowish type of there is things is there. You know, so this slide is a very important slide here. Displays right tonsil. So you know DD, there's a quinsy, pharyngitis. So these are the slides which you give a guidance or idea, some you. And here you say there is a pus follicular on left tonsils, follicle that form a beads. Then there is a push, that is a tongue. Each thing is written in an arrow base, so it's easy for you for the understanding. You know, this is also a good picture. You know, uvula is there and the tonsil side are huge. There's an enlarged both side. You know, this is also a slide of your DD. Now there is a complication. What happened when you not treat acute tonsillitis? What happened? That term we use as a complication. That term use complication. That patient have put, sir, मैंने एक एथ्रोसिन ली, एक पैरासिटामोल ले ली, एक लिंकोसिन लगवाया, एक ये लगवाया, एक ये खाया, 2 दिन मैंने ट्रीटमेंट खाई, एक छोड़ दी. That things are going towards the complications because improper treatment, high virulence of the organism and the low resistance. The first complication, if you have not treated the proper, going to chronic tonsillitis. Second one is the quinsy. Third one is the parapharyngeal abscess. Fourth one is the suppurative cervical adenitis. Then acute otitis media. Then laryngeal edema. Respiratory and food passage obstruction. Thrombosis of the internal jugular vein. Generally, what happens in our body? These are the things which are present mostly in throat sides. But here B class, that in whole body suffer if you have not treated proper acute tonsillitis. That is bacteremia. Second one is the pymia. And third one is the septicemia. Now here, there is a DD between acute tonsillitis and the pharyngeal diphtheria. You know that there is a features onset, age, toxicity, membrane. Acute tonsillitis sudden within 24 hours. Age any. Pharyngeal diphtheria, that is slow 1 to 3 days, generally 2 to 5. There is a marked toxicity. Patient toxic but alert in acute tonsillitis. So this is a one comparison that you have and must be mind. That is what is the main reason of diphtheria which confuse with the acute tonsillitis, especially in which when there is a membranous tonsillitis, that we have a confused whether it is a pharyngeal diphtheria or there is acute tonsillitis. So at that time we have that DD in front of us. Okay. This is the whole things. Bacteria that have a different mark of a tick, that have a different fever level, that have a different snake ID node, that have a difference. So you must be remember these differences. Now, thank you. Today we have complete our anatomy of the tonsils and the anatomy of throats and acute tonsillitis. So next time we are going to a chronic tonsillitis, in which we have idea that what happened when there is a chronic tonsillitis, and you know when there is a chronic, the medical treatment is a fail, and then surgical treatment is a top priority. Thank you very much. एंड हो गया लेक्चर। तो कुछ बात करना चाहते हैं, कुछ करेंगे क्या? जी जी, यहीं रहिएगा ताकि पता लगे कि कुछ। हेलो जी बेटा।
सर
जी
सर मुझे ये पूछना था, आपने अभी कहा कि मतलब ना नोज जो है वो कंप्लीट हो गया है, लेकिन उसमें तो आपने सिर्फ 4 लेक्चर्स लिए थे, एपिस्टैक्सिस, साइनोसाइटिस, डीएनएस और फॉरेन बॉडी का।
ठीक है, जो लिया है उसी को आप फाइनल समझे अपना।
सर बस और कुछ नहीं करना?
जब हम आपका एग्जाम भी लेंगे तो ये टॉपिक सामने ही रखेंगे जो मैंने टिक किए हुए हैं, और जो मैं पढ़ाऊंगा वही आपको जो है उसमें होंगी हर चीज। बाकी आप फर्दर
थैंक यू सर,
वो मैं उनके सामने रख दूंगा एग्जामिनर के बेटा, कोई आप नहीं। और ये भी ऐसी 4 टॉपिक 5 होंगे थ्रोट में, वो भी, और जो सब आपने कहा है वो मैंने टिक कर लिए हैं, उसी में से इंशाल्लाह आपसे हर चीज पूछी जाएगी।
जी थैंक यू सर।
और कोई बेटा से बात? जी 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 जी, थैंक यू।
आपने एक चीज मिस कर दी।
वो कम करें
सर आपने पोइट्री नहीं सुनाई।
क्या नहीं बनाई?
पोइट्री नहीं सुनाई।
पोइट्री, हाँ वो मैं कहता था कि स्टेज पे मजा आएगा, यहाँ आपको मजा नहीं आएगा बेटा। क्या मजा आएगा पोइट्री सुन के?
सर हम वेट कर रहे थे।
पोइट्री तो सुनाने में हमें तो कोई हर्ज नहीं होता, लेकिन मैंने लगा वो सारे अच्छे होते हैं तो एक्सप्रेशन सामने आती है तो उसमें मजा रहता है।
नहीं लेकिन अभी भी हम हंस लेंगे।
अच्छा जी, देखते हैं।
ठीक है सर।
चलें जी, सुन ले।
चलो
हाँ सुने जी, ज़रूरत के मुताबिक हम सहारे बांट लेते हैं। मोहब्बत करने वालों की तिजारत भी अनोखी है। मुनाफा छोड़ देते हैं, खसारे बांट लेते हैं। अगर मिलना नहीं मुमकिन तो लहरों पर कदम रखकर अभी दरियाए उल्फत के किनारे बांट लेते हैं। मेरी झोली में जितने भी वफा के फूल हैं, इनको इकट्ठे बैठकर सारे के सारे बांट लेते हैं। मोहब्बत के अलावा पास अपने कुछ नहीं इकबाल, इसी दौलत को हम किस्मत के मारे बांट लेते हैं। बहुत शुक्रिया। थैंक यू। अल्लाह हाफिज। बिल्कुल ना घबराइए, इंशाल्लाह मैं साथ हूँ आपके। थैंक यू।